We'll have that report in a moment because the story is that Google's head and Microsoft, the head of Google's parent company, Alphabet, has pledged $18 million for India, and the head of Microsoft has also pledged with helping India with its oxygen supplies. On Sunday, the United States, UK, and the EU also promised India help, the US promising to provide materials for vaccines in India. We have joining us now Chairman, Special Advisory Committee on COVID-19, Professor Oyewale Tomori, who joins us from Ibadan in Oyo State. Professor Tomori, thank you for joining us today.
My pleasure.
What do you make of the surge in the coronavirus cases in India?
I think it's very worrying. It's also a warning for us. India was doing very well before this surge came. But then there are a few things that reported that they were doing, which I think may be responsible. We're told that political campaigns were going on in different states of India. We also were told about this festival at the Ganges River, which attracted millions of people. I think the combination of that, and then the fact that most people have kind of abandoned the non-pharmaceutical interventions, all combined to bring the surge into India.
Yeah, and it's been reporting really high numbers lately. Yesterday, there were almost 350,000 new cases in 24 hours. Today, the figures have also gone up to about over 300, almost 340,000 cases in India. Now, you see the similarities between India and Nigeria. They both have huge populations. And I'm just wondering whether, Nigeria could also be at risk of experiencing the sort of surge that India is going through at the moment.
I think one or two of the factors responsible for the Indian is there. I mean, we have abandoned the non-pharmaceutical interventions in the country, so that's number one. Number two, we are not vaccinating like India. I mean, we are not even started, so that's another major concern. I also worried about, I don't know what's going to happen, when we finish the Ramadan fast, but that's going to bring in many people. So we see factors that were in India. Now we're in a lull period. And if all these factors come to play, and then we don't know what kind of variants we're getting in the country. So, of course, if it comes, I won't be surprised.
Indeed, no surprise there. Professor, just before we continue, I'd like to draw attention to, the story, which is that the global efforts are increasing. More countries rallying to help India. We have that report on the situation in the country. This has become a common sight in India. Loved ones administering oxygen to family members outside of hospitals as the country battles with rising number of COVID-19 cases and a shortage of oxygen. Crowded hospitals running out of oxygen has overwhelmed the country's health system. Prime Minister Narendra Modi had on Sunday asked citizens to get vaccinated and exercise caution, while hospitals and doctors are putting out notices saying they are unable to cope with the rush of patients. The US, UK and the EU have promised aid in ventilators and materials for vaccines. Now, tech giants Google and Microsoft are pledging their support as well. Sundar Pichai, head of Google and parent company Alphabet, says he was devastated by events and the firm would provide $18 million in funding. Microsoft boss Satya Nadella says he's also heartbroken and would help India in this shortage of oxygen supplies. Both chief executives were born in India. Back in India, some are trying to leverage the power of Twitter to source oxygen cylinders, hospital beds and other forms of help. People seeking help and those with information of resources have been sharing telephone numbers of volunteers, vendors who have oxygen cylinders, or drugs and details of which medical facility can take patients using hashtags like COVIDSOS. Today, many patients form long lines outside hospitals, some with oxygen masks in ambulances. Infections in the last 24 hours have risen to 352,991. With overcrowded hospitals in Delhi and elsewhere, turning away patients after running out of supplies of medical oxygen and beds. India has asked the European Union to send medical oxygen and Gilead's antiviral drug remdesivir to fight the surge in cases. With the surge, also is a rise in the number of deaths, resulting in more cremations. The country, with a population of 1.3 billion, has an official tally of 17.31 million infections and 195,123 deaths. After 2,812 deaths overnight, the Health Ministry says the figures probably run higher. Professor Tomori, you just saw that report, the number of cases rising 352,991 in 24 hours alone, and the number of cremations have also increased. Really dire situation. But what is also surprising is that India has had a huge vaccination campaign, and yet it's seeing also a huge surge in cases. What does this say then about the vaccinations?
I think what it tells us is that vaccine alone is not the solution. Vaccine is just an additional to the things they are already doing. If you break one of those MPI things, you are not wearing your mask, you are not washing your hands, you are gathering together in large quantities. Of course, the vaccine only has a little bit of action to do. So it only adds on. It is not the totality of it. And you remember the British Prime Minister did say that in terms of what is more effective, it was more the lockdown than the vaccine. Because when you lock down, then you reduce the transmission of the disease, the spread from different people to different people. But when you let loose, then of course the virus will let loose and spread. And in India, we're looking at 1.something billion people. So even if you vaccinate 300 million, it's still a little chunk compared to the large size of the country.
Wow, and speaking of those vaccinations, it's already been established, as you said, that one still needs, those non-pharmaceutical processes for staying safe, the wearing of face masks, the washing of hands, the use of hand sanitizers, and then social distancing. People are still being vaccinated with those. So should they test before vaccination? Because I'm wondering, if people are just getting vaccinated, shouldn't they also have a test, to check if they have the coronavirus? What could happen if an infected person gets the vaccine?
Yeah, ideally, with the efficacy of the vaccine that we're getting, the chances are that people would develop immunity. But then immunity doesn't develop the day you get the vaccine. It takes another 10 days to about 2 weeks before your body gets the level of immunity that can protect you. And of course, we know we have to give 2 shots with this vaccine. Therefore, that first shot will only give you up to a level, not strong enough. The second dose will have to bring it to the maximum level. I think the problem with people is assuming that once you get the vaccine, then therefore you are free. No, you still need that interval between the time you get the vaccine and the time you develop. You are still vulnerable. And so that's why it is still advisable. Please wear your mask. And again, but the vaccine does not protect you from exposure, nor does it sometimes even protect you from infection. All it does is it stops your infection becoming disease or hospitalization. So once people know the limit of the vaccine, then they will know that they need to add other things to it to help the vaccine achieve the objective of what it is. As for people who have had an infection before, if you have recovered from the infection, there's no reason. In fact, the vaccine should boost your immunity. But of course, if during the period when you are still recovering or you have the disease, getting an additional vaccine may be an added burden on the body and could be the other result. But then once you recover, the body has some immunity. Getting a vaccine will also boost that immunity. You see what we do with polio, give it to children at different intervals. We do the same thing with measles, even yellow fever. After you've had it, you still get a second dose. That will boost up your immunity. So people who have recovered from COVID should get their vaccine because it also helps them to have a better level of immunity.
Yeah, but Professor, just very quickly, I want to go back to the 1918 pandemic, the Black Flu, which eventually, disappeared after 2 years due to herd immunity. Is there hope that the coronavirus could clear up much faster, seeing that we do have vaccines now? Then there were no vaccines for the Black Flu.
Yeah, I think I believe that this is what is going to happen. But remember, in those days, traveling was not as fast as what it is now. So spread was not it took a much longer time and involved millions of people. Eventually, when many people, the so-called herd immunity came up, the epidemic died down. I suspect this is going to be the same. But then we need to have, this is quite a different virus, but I think they all behave similarly. It's a respiratory virus, and eventually I think we'll probably end up to endemic state. It's not that there won't be cases, there will be cases, but not the kind of epidemic proportions we are getting right now.
Professor Yewale Tomori, the chairman, the Special Advisory Committee on COVID-19 in Nigeria. Thank you again for speaking with us on The World Today.
My pleasure, Marachi. Thank you.